65 years old lady came with complaints of left knee joint pain for past 6 months. She was given an opinion of left knee replacement in other hospitals. Even I do suggest the same. As patient wants for conservative management, I am going to try BMAC. So the equipment needed for this is a dressing tray, bone marrow aspiration needle, 4 pre-filled heparin syringes, 1 local anesthesia spinal needle, and 2 PRP tubes for extraction. Patient was in prone position, PSIS is identified, local anesthesia was given, bone marrow aspiration needle was passed into the PSIS and able to feel the bone. Now I am going to feel the bone and slowly looking for giveaway. As it passes through the outer table, I can feel the sensation of softening of the bone tissue. It can be visible on the C-arm right at the posterior superior iliac spine. I am going to adjust the same and bringing back into the center. I am inserting the heparin 0.5 ml and I am trying to draw the bone marrow aspirate. You can make out I am nicely aspirating the bone marrow in the 10 ml syringes. I do prefer using 10 ml syringes over 20 or 50 ml because the pressure generated by these 10 ml syringes will extract more MHC cells rather than called stem cells compared to the 20 ml or 50 ml syringes. Evidence also suggests that using of 10 ml syringes is preferable over the 20 or 50 ml syringes. Here I am using 4 heparin pre-filled syringes, injecting little heparin into the bone marrow, and again I am withdrawing the aspirate. I am total now I collected around 40 ml of bone marrow aspirate, and I am happy to find that I am getting a good volume aspirate here. Okay, slightly adjusting the bone marrow needle so that I can go little deeper and I can get better BMAC. So it is also an important step to adjust the bone marrow needle while withdrawing the aspirate. Now I have aspirated 40 ml of bone marrow from posterior superior iliac spine. Now I am going to transfer into the tubes. I have placed the tubes in the centrifuge. The centrifuge was done at 1420 rpm for 10 minutes, and this is the product. You can make out the RBCs. The plasma is separated by centrifuge technique. So I am going to separate RBC from plasma. So the specialty of this tube is we can easily separate RBCs from plasma by just turning the knob at below. So by turning this knob, it's going to push the entire substance through that small passage, which is going to collect into the upper chamber. Here you can make out While I am turning the knob, slowly the plasma is entering into the upper chamber. So this has to be done till the RBCs enters into the brim of the nozzle. That you can make out. I'm going to slowly turn the knob and getting the RBCs into the brim. So at this point, I'm going to stop the nozzle. So now we separated RBCs from plasma. This plasma again has got two components, one at below and one at the upper thing. The upper one is platelet poor plasma and the below is the platelet rich plasma. Rather than here it is rich with the growth factors. So again I am going to centrifuge this so that the plasma, poor plasma will come into the upper chamber and rich plasma is going to come into the lower chamber. So the centrifugation has to be done twice in order to get a good concentrate of growth factors which are going to aid us in regeneration of the cartilage. Finally, this is the preparation I have got after 2 centrifuges. You can make out this is a pure bone marrow aspirate concentrate. It was again sent to the lab and I was able to see lot of platelets and WBCs, which indicates I have got a good number of mesenchymal cells. Under ultrasound guidance, I have located the joint. I'm slowly passing the needle. You can make out the needle in the screen there. Slowly I'm going to inject the bone marrow aspirate concentrate into the joint. Slowly. And patient is comfortable here as I have given local anesthesia before the injection. Slowly I am injecting into the suprapatellar bursa and into the joint. Yeah, I have done with almost 2/3 of the aspirate into the lateral joint and 1/3 of the aspirate is going to be injected in the medial joint space. I have found the soft point, injected needle, and I am slowly giving into the space. I was able to get a free flow indicating my needle into the joint. This way I have completed the procedure. I am giving little local anesthesia again just to push the whatever remnant in the needle. Slightly mobilizing the joint and make sure that I'm spreading the aspirate evenly. And I am done with the procedure. This way